Hello everyone, welcome to OrganonEasy. Today we will discuss aphorism number 71. We have already discussed in some videos that this is the beginning of the practical part of Organon of Medicine, and up to 70, aphorism number 70 is a summary of whole of the theoretical part, and now the beginning of practical part. And this is the common theme of Organon. Before starting any topic, Hahnemann tend to summarize the whole topic which is coming up. Okay, so aphorism number 70 is the beginning and beginning of the practical part and a brief summary of the whole. Like aphorism number 3, aphorism number 1 was setting the mission, and aphorism number 2 was the cure, and aphorism number 3 was the knowledge of physician. Whole of the theoretical part was summed up in aphorism number 3, and now whole of the practical part is being summed up in aphorism number 71. So before we start, if you're new here, consider subscribing. In this channel, we used to discuss practical part of Organon and practice related tips. So aphorism number 71 discusses 3 knowledge of physicians. Okay, means knowledge of if you sum up is number 1 point has been how is the physician to ascertain what is necessary to be known in order to cure the disease. That is knowledge of disease. Okay, knowledge of disease. Next is see how is to gain a knowledge of instrument adapted to cure. What is the instrument adapted to cure? It is nothing but medicine. This is a bit philosophical language of Hahnemann. Instead of saying one word of medicine, he is using 2 or 3 words, and even at some time a phrase is being used for us defining a single term. Okay, that is the problem with the language of Organon of Medicine, that it has been written in the period or translated in a period when the literature was so much dominant. Okay, nowadays we have lost touch with literature part in the modern age of WhatsApp statuses, WhatsApp status and WhatsApp messages. The literature part has somewhat sacrificed, and that is why it is difficult to follow language of Organon for our new generation. So knowledge of remedy, that was a side topic. Why the knowledge, why the Organon is being difficult nowadays, leave it. This knowledge of medicine. Okay, knowledge of medicine. And number 3 is this application of these 2 knowledge. This is number 3. Okay, judicious application of this knowledge. Judicious application of this knowledge. Okay, now consider this. This is knowledge of medicine, knowledge of disease you are getting. Okay, now this is your knowledge of medicine and how to apply. This is judicious application. Similia, similibus, curenter. This knowledge of medicine, knowledge of disease and knowledge of medicine is being applied practically. Okay, that is the judicious application of these 2 knowledges. Okay, you can apply this, you can apply this, you can apply like this, but this is the judicious application. Similia, mirror image. Okay, antitype has been a term has been discussed in Organon of Medicine. These knowledge of disease and knowledge of medicine should be antitype to each other. Okay, now this knowledge of disease has been divided, if you see carefully, from 72 onward. This knowledge of disease has been divided in 2 parts. This knowledge of disease has been divided in 2 parts, and that is knowledge of disease in general and knowledge of disease in particular. Okay, now you follow the part where the Hahnemann have discussed chronic diseases, acute diseases, types of chronic diseases, types of acute diseases. So it is falling under knowledge of disease in general. It is falling under knowledge of disease in general. Now, just after finishing of this section, you will get the case taking. Okay, so in a particular case, okay, in a particular case, what are the peculiar constitution? Individualization is the basic essence of homeopathy. You cannot prescribe a medicine, single medicine to all the typhoid cases. Okay, so this is a typhoid case, is coming from this knowledge of disease in general. Okay, this knowledge of disease is coming from this section, from 72 80, some 72 to 82. This is coming from here. You will get knowledge of disease in general, and or plus knowledge of disease in general you are getting from your allied other medical subjects. Okay, like surgery, practice of medicine, gynecology. Okay, all these are your basis of knowledge of disease in general. Okay, but knowledge of disease in particular, a particular case of typhoid fever, you know, the typhoid fever has 4 weeks, and what are happening in first week, second week, third week, and fourth week. Okay, what are the complications of fourth week? What are the tests you have to write in first week or second week or third week? You all know this regarding typhoid fever from knowledge of disease in general. But to prescribe upon, you need to know what a particular typhoid case has symptoms. Okay, that is coming from knowledge of disease in particular, and that you will get from case taking. And you will see that exactly after finishing this knowledge of disease in general, Hahnemann starts with case taking, and that is the knowledge of disease in particular. So what is to be cured in disease you should know, and both consist the knowledge of disease. Okay, so knowledge of disease in particular you are getting from this case taking. So consider this, we have told that this is knowledge of disease. Now this is, consider this knowledge of disease in general. Okay, forming the base. Okay, now you are exploring the case, so getting the symptoms, knowledge of disease in particular. Okay, knowledge of disease in particular, you are getting these symptoms. Now if these symptoms are missing, what it is called, if only few symptoms are there, if only one symptoms are there. Okay, what is this called? This is called one-sided disease. And if you are not having a symptom, it is difficult to apply your knowledge of medicine here. You need symptoms. Okay, if it is deficient, 2 causes for this deficiency. Number 1, defective case taking. Okay, due to defective case taking, you are getting, that has been discussed also in aphorism number, I think 170, for that defective case taking. I think it is aphorism number 175. Okay, defective case taking. When there is defective case taking, this knowledge is incomplete. Plus, even if you have tried to drain your patient completely by an effective case taking, still you are not getting the symptoms. These are one-sided disease. Okay, and this is very difficult to cure because this knowledge is incomplete and you cannot apply your knowledge of medicine here. Okay, clear? In that case also, whatever available, one-sided, how to proceed in one-sided cases we will discuss in some other class. But in that, whatever is available, if this thumb symptom is available, apply this your thumb symptom here. Okay, so this is the process of proceeding in one-sided cases. Okay, so if this knowledge of disease in particular is deficient, it is very difficult to proceed further. So knowledge of disease in general, knowledge of disease in particular. Now knowledge of medicine. Knowledge of medicine. Again, these are 2 types. There are 2 types. Number 1, again same, knowledge of medicine in general and knowledge of medicine in particular. Okay. Okay, now think yourself, what consists of knowledge of medicine in general? This is the pharmacy part which has been discussed in Organon of Medicine. Okay, I think from 262 onward. From 262 onward, this knowledge of medicine in general, knowledge of medicine 264 onward, sorry, 264 onward, 264 to 271. That is the knowledge of medicine in general. The pharmacy part, kingdom, vegetable kingdom, animal kingdom, how to identify a genuine drug, how to procure a genuine drug, how to collect herbs, how to collect this animal products. All these are knowledge of medicine in general. Now, knowledge of medicine in general plus this will help you to identify the genuine drug, plus to some extent to use the potency or for the repetition, because the particular type of medicine, if it is deep acting, from deep acting, like if it is nosode, how to repeat it. If nosode should be prescribed a potency above, most effective in potencies above 200, like this. So knowledge of medicine in general will help you, and knowledge of medicine in particular, what is this and from where you are getting this? Think a bit and you will get your answer. After case taking, what starts? Just after case taking, what starts? From 105, the drug proving. Okay, so knowledge of medicine in particular you are getting from drug proving. Okay, nowadays you need not to prove every drug, because the older homeopaths, previous generation predecessors have already worked very hard. Hahnemann and his group of provers have worked very hard and collected all the symptoms, all the possible symptoms of many of the polycrest medicine which are being used today. So this knowledge we are getting second handly from the Materia Medicas. Okay, and which kind of Materia Medica you have to follow for getting this. Before going to that topic, we need to know that why this drug proving is important. Okay, why we need to learn this drug proving? Because if a new substance, you are practicing in some area where you got that local people are using some new substances, you need to prove that medicine in order to use it as homeopathically. Okay, like many of the Indian drugs have been included in our Materia Medica after provings. One of the book, this Drugs of Hindustan, is an example by Dr. S.C. Ghosh, where he have proved some Indian medicine, not a whole proving, but means like Hahnemann have proved every medicine to whole extent. It is only partial proving, still it is being used by he has introduced so many Indian drugs in homeopathy and is being used in our practice. Okay, like that. Hale's new remedy, when he went to practice in America, he found that that Red Indians for practicing folk medicines, and from there he introduces many new remedies in homeopathic Materia Medica, like Fraxinus, like many other drugs, new remedy. Hale's Materia Medica of new remedies, where he have proved and introduced many new remedies. So you can be the one who can introduce some new medicine in homeopathy. So you need to learn the process of drug proving and importance of drug proving. So you need to go through these sections and instructions of Hahnemann. Now come back to where from the knowledge of particular we are getting nowadays. We are getting from Materia Medicas, and how many types of Materia Medicas are there available nowadays. The source of all those are proving symptoms. Okay, and where you will get proving symptoms? In Materia Medica Pura. Proving symptoms, okay, in Materia Medica Pura, in chronic diseases. But Materia Medica Pura is purely proving symptoms. Materia Medica Pura is purely proving symptoms, okay. But in chronic diseases, you will get some clinical symptoms also. Clinical symptoms also, okay. So that is why Materia Medica Pura is pure in regard to proving symptom. Whatever have been recorded there have been observed in provers, but there have been recorded in chronic diseases had been mixed up prover plus clinical symptom. What is clinical symptoms? It is the one physician's own observation. So we cannot push our patient to the extent of pathological. So this is a kind of clinical symptoms you are getting, plus some clinical symptoms which are at the functional level, have not been observed in proving, but it has been seen that it has cured such symptoms, so was included in our Mathematica. So that is clinical symptoms, but these clinical symptoms are not often reliable. Not often reliable, and the clinical symptoms in the modern Mathematicas published recently in the extent of 20 or 30 years or last 40 years has not been tested. Rather, it was just included in our Mathematica. So these Mathematicas are not very much reliable. So there's most reliable Mathematica for getting proving system is Mathematica Pura, and one is Cyclopedia of Drug Pathogenesis, uses Cyclopedia of Drug Pathogenesis, where we have proved many medicines up to 12 potency. Okay, he has not used potencies more than 12. So that is another case we will discuss why he have used only up to 12 potency. Now the Mathematica we are following nowadays are of many types. You will get some Mathematica which are having only symptoms, okay. Plus you will get some Mathematica where symptoms, proving symptoms plus clinical symptoms, okay. Proving symptoms plus clinical symptoms, okay. You will get some Mathematica where proving symptoms plus clinical symptom plus author's own commentary, okay. You will get Mathematica where all these symptoms, proving symptoms and clinical symptoms, have been combined to make a drug picture, okay. These have been combined to make a drug picture plus author's own commentary. Out of all these, now those Mathematica which have this proving symptoms plus clinical symptoms are most reliable, like Allen's keynote we are having, but there is no distinction between clinical symptoms and proving symptoms, okay. So to distinct between proving symptoms, which are proving symptoms, which are clinical symptoms, you have to go to Herring's Mathematica, because these are coming from Herring's Mathematica. So Herring's Mathematica has clear distinction of what is proving symptoms and what is clinical symptom. And in some older Mathematicas, you will get a star mark or some indication that this has not been found in proving, but it has been recorded in clinic. So clinical symptom. Most popular book we are using nowadays is Allen's keynote, and maybe it is most reliable source of our knowledge of medicine, in particular after Mathematica Pura, means most reliable plus most used. Many of the students, many of the practitioners are using Allen's keynote to get the knowledge of medicine in particular. So plus now symptoms plus clinical and plus commentary, this you will get in Nash type of book, okay. Nash types, where the author's own clinical experience have been discussed with what should be the repetition, what should be the doses, how to use this and that. So this is commentary. Now drug picture Mathematicas, where the drug picture has been given. The source of all these Mathematica you can trace back to Kent's lecture, where Kent have tried to give a picture of a drug by compressing these proving symptoms and clinical symptoms, like pulsatilla, girl in a family, sepia, lady in a family, rat, philosopher of sulfur. But Kent have not compromised with symptoms also. He have given symptoms also, those commentary and drug picture. But modern days Mathematica you will get only drug picture, okay. That is very much deceiving and can be easily misled Okay, people are saying in modern mathematicas, I have seen people are saying that that person will behave like a lion and you have to give lion's milk. Person is like behaving like a dog and you have to give dog's milk or lysine. Okay, these are very misguiding and very misleading, and you will not get the knowledge of medicine in particular. It is the symptoms. Okay, this was the knowledge of medicine in general, and this is knowledge of medicine in particular, which it is the symptoms which is necessary. Okay, so modern days mathematica having the drug picture and commentary are very misleading. Okay, Kent is to some extent much better than those mathematica of modern days, because Kent have not left the proving symptoms and clinical symptoms. We have given those symptoms plus a basic, composed understanding of a drug, that is drug picture. But you are following directly a drug picture without getting symptoms of that drug, that is often misleading. Okay, better than Kent's mathematica for a beginner is M.L. Tyler's mathematica. Okay, because she has given the symptoms its proper place plus her own commentary plus a picture is her book's name is Drug Picture. A picture of that drug also have been given. To understand this, you need to go through sepia of Tyler's. Sepia is the model of drug picture to study from M.L. Tyler's. Okay, so from where we are, we will collect our knowledge of medicine in particular from the proving symptoms, and then proving symptoms from the book which has given only the symptoms, proving symptoms and clinical symptoms. And to distinguish between clinical and proving symptoms, clinical symptoms are not always reliable. To distinguish between proving symptoms and clinical symptoms, you need to follow the older text where the provings and clinical symptoms have been distinctly marked. Okay, and never to go to those drug pictures which are giving only drug pictures without any symptoms, and it is often misleading and dangerous to follow. Okay, you won't be able to practice homeopathy by getting these knowledge from those books. Okay, so this was the knowledge of disease in general, this was the knowledge of disease in particular, and this is the knowledge of medicine in general, and this is the knowledge of medicine in particular, and this was the judicious application. And that covers our third topic, how to apply this knowledge. Okay, how to apply. This is judicious application. Homeopathically you have to apply, plus the mode of repetition, the potency that has been discussed followingly after those. Okay, so I hope this topic is clear. Write to us if you want to discuss some more topics or some difficult topic which is difficult to understand or difficult to go through. We will discuss here. Till then, thank you.